Hello, Maya here. I want to talk to you about a book that I'm reading. It is Chris Wark's book, and it is his over a decade worth of research and information, and I am underlining this book like crazy. Well, the other day I was reading it, and my heart dropped because this is part of, excuse my nails, I let my preschooler paint them. So they're all over the place. Part of the problem that I see when it comes to people seeking or going with conventional treatment is the lack of power and empowerment they are given. A lot of times it's a doctor saying, this is what we need to do, this is when we need to do it, and the patient saying, okay. And that's not how it should be. When I got certified last year as a health coach, I was reiterated to that it is a partnership between the patient, the individual, and the doctor. It is a working relationship. I mean, in essence, we're the ones hiring that doctor, right? So we can fire them if we want, and we can go for a second opinion if we want. We can go for a third opinion if we want. But oftentimes we've kind of just gotten so overworked and overstimulated and just tired and exhausted that we don't maybe do that. We actually just go with whatever the doctor says and we go with the flow. If we go with the flow, this is where my problem is the poor communication. I mean, we've all heard that saying, right? There's poor bedside manners by a medical professional. There's actually just poor communication, period. Now, we have to remember that doctors go to school to learn one way of medicine, which is the synthetic way. And so they don't know all the options. They're not going to present everything to you unless in your relationship with your doctor, you start to ask questions and you start to get in a dialogue. Now, I'm not saying your doctor is going to be receptive. Prayerfully, they are. But I've heard so many stories about when they're not receptive. I've gotten very blessed with my kid's pediatrician. We can actually have an open dialogue. And I'm not called stupid. I'm not called an idiot, where I've heard those stories of moms being called that by doctors because of the questions they're bringing up, just because they want more information. That's not okay. So not only is there that extreme communication, but sometimes there's not correct communication. So let's say you ask a question and the doctor gives you an answer. Is he really giving, or is she really giving you the answer that you asked, or is it a muddled answer? Because in this book, I highlighted quite a bit, or underlined quite a bit in this communication breakdown section, because this is where the struggle is. This is where it seems like the patient can't ask questions. And if they do, then they feel like maybe they're not getting a straight answer, or if they accept the answer, then they don't know they're not getting a straight answer. And it's because we have to remember medical professionals go to school to learn one mode of treatment, which is treatment. It's not to cure or to heal. And so chances are the answers are only going to be for short-term or temporary situations, but it's not really presented that way, right? That's because language matters. Words matter. That matters. So let me read you some parts because it's kind of sad. It's unfortunate, and I want to share this with you because I want you to be aware. So cancer is really prevalent, right? 1 in 2 in men, 1 in 3 in women. Sometime in their lifetimes, they will get some type of cancer. And that's only going to continue to increase as we continue in the environment, lifestyle, dietary choices we live in, because we are just over inundated with toxins and chemicals that suppress our immune system, which is where a lot of the sickness and illness come from, right? Is from a weak immune system, which lies mostly in our gut, which is why gut health is a huge thing. I digress a little bit. In 2012, a study showed that 70 to 80% of terminal lung and colorectal cancer patients surveyed thought, so 70 to 80% of these patients that were surveyed thought that the treatments they were receiving were likely to cure them, when in fact the patients were only given chemo to buy some time or improve their quality of life with no intention of curing their cancer. And he gives a citation here. And so the next portion of it is the very unfortunate part. And I know I want to preface that there are medical professionals out there, doctors and nurses, who are truly in the profession because they want to help people. Just like I went into special ed teaching. I wanted to help kids, but I came up against hurdles and glass ceilings, and it was hard because I felt like I couldn't do my job because I wasn't the boss. I wasn't in charge. There were other people over me running how much I could do ultimately. And so it became a very exhausting situation for me. So I can only imagine for those doctors and nurses who do go into it to help people, how they feel. Their hands are tied. They feel trapped. So, but the follow-up to that study, 70 to 80% were under the assumption that they were going to be cured from this treatment when it was really just buying them time. Lack of communication, right? And lack of questions on our part as patients. We just kind of assume these people went to school for so dang long, they know. They just know. No, it's okay to ask questions. We should be asking questions. We're in a relationship, right, with our medical professional provider. So when doctors were questioned about their failure to communicate the difference between curative and palliative care, a common excuse was, quote, "It's hard to tell patients that you can't cure their cancer," end quote. I find that irresponsible. Just because it's hard to tell somebody, I can't cure this for you, but it'll give you an extra 6 months, doesn't mean you shouldn't say it. So, some other sections in here where oncologists often use convoluted terminology, medical jargon, and positive sounding words like benefit, successful, effective, and working to describe cancer treatment. But what those words mean to a patient and to an oncologist are very different things. It's common for patients to hear things like, your type of cancer is shown to respond favorably to insert whatever drug therapy it is, or, quote, this treatment has been shown to be effective and works well with your type of cancer, end quote. That doesn't mean anything. And here's the sneaky part, is it could just be shrinking tumors, or maybe it's getting rid of it, but do you know the treatments often years down the road will end up causing other cancers in other parts of the body. Completely seems unrelated, and it's not. But what got me where I was like, ooh, this is sneaky. So let's say a patient gets a treatment and it's attractive to them, so they go through it. Okay, let's start here. For example, let's say that after surgery, a patient has a 6% risk of recurrence within 5 years. 6% risk of recurrence within 5 years. Because generally it's after the 5-year mark where you start to see increases in recurrences for cancers. But let's say within 5 years, there's only a 6% risk for recurrence. And the patient is told that the recommended chemo regimen has been shown to reduce her absolute or overall risk of recurrence from 6% to 3%. Doesn't sound like a big deal, right? It sounds like that margin is way too small. So let's say that patient might be inclined to pass on the chemotherapy because her risk of recurrence after surgery is already low at 6%. But this is what got me. And it's not like I've had cancer, right? So I've not heard this language, but because my own health pivot started with my mom getting breast cancer and then me diving into the cancer prevention world, I have seen how language matters. So reading this, It's so disappointing because we have so far to go to be able to just have conversations and empower the patient. Okay, so 6% to 3% is the reduction for overall risk if she were to do the recommended chemo regimen. But the same therapy that reduces the absolute risk of recurrence from 6% to 3% can also be described, so there's another way of saying that, as reducing relative risk of recurrence by 50%. Do you hear the difference? Talking to a patient and saying, well, there's generally about a 6% recurrence rate within 5 years for you. And so if you do this chemo that I'm recommending, it'll drop it down to about 3%. A patient might be like, no, I think I'm good. But if a doctor were to say, if you do this chemo regimen that I'm recommending, it's going to reduce your risk of reoccurrence by 50%, because 6% to 3% is technically 50%. Do you see how sneaky that is? And I'm not saying every doctor does this, not at all. I'm not saying every oncologist does this. I'm making you aware of the language and the choice of words. And this is why it's important to be proactive and ask questions. So this is often how pharmaceutical sales reps sell new drugs to physicians. So you don't need to blame your doctor necessarily, because they're getting that same verbiage from the sales reps. And so it's not necessarily originating from your doctor or your nurse. It's coming from those trying to sell them those drugs and those treatments. It is unfortunate. It is happening. Doesn't happen 100% of the time, I know that. But the fact that it happens at all, terms like increasing overall survival, remission. Did you know there's 2 types of remission? There's actually full remission, which takes years to determine if somebody's in full remission. And then there's partial remission. I'm just so saddened by the fact that the communication barrier is there between doctor and patient, nurse and patient, because questions oftentimes aren't asked. And if questions are asked, then the patient might be belittled in a sense, or the doctor can't answer. And that's okay. The doctors don't know everything, right? Nobody should feel like they should know everything. I don't know everything. So one last thing I want to mention. This says, in a recent study, researchers reported that complete remission rates were 76.5% for a subset of obese patients with acute myeloid leukemia. Remarkable, right? It sounds like, what? 76%? That's high. For complete remission rates, remember I said it takes several years to be fully in remission. It says not so fast. If you read a bit further, the authors disclose that the average survival of these patients was only 14 months. 14 months. Complete remission often only means that tumors are gone temporarily, not that the cancer is cured, because it takes years to determine whether a complete remission will become a permanent cure. Yet it is perfectly acceptable for an oncologist to tell an obese leukemia patient that chemotherapy treatment for AML, which is the acute myeloid leukemia, achieves complete remission in 76% of cases. And what patient wouldn't say, yeah, I'll do it then? 76%? That's pretty good odds. So I want to end there, but the focus is really to be on communicating, asking more questions, get curious, get uncomfortable, The doctor will probably get uncomfortable if they can't answer questions. The nurse will probably get uncomfortable. It's okay. Have empathy for them. They don't know everything. We don't know everything. It's new for you. Whatever you're asking questions about, you're stepping out because you want to be proactive. You want to be informed. You want to know the truth around the details because this is your body. This is your one life, right? You got to take care of your temple. And so we really have to, as patients, get proactive and ask questions, but not aggressively. We need to have empathy because the people on the other side went to school. We have to remember, went to school to learn a very specific route of medicine. One option, one way, which is a synthetic way. And there are other options, but you need to start getting into that conversation with your medical care provider in whatever you want to start asking questions about. Maybe your gut's starting to talk to you. You know you have more neurotransmitters in your gut and your brain than any other part in your body. So your brain and your gut do talk to each other. If you've ever heard of the brain-gut axis, there is a reason for that because they legit talk to each other. And it's a good thing they do because this will overthink things, right? And talk you out of stuff. Whereas your gut's like, I'm still there. Like my gut's, it just had a gut feeling, but you overrode it up here. You decided that the gut feeling wasn't important enough, or it just maybe is a little misguided when it's not. Instinct, intuition, your heart too. How many of us listen to what our heart tells us? And so it's going to cause you to get into uncomfortable situations or an uncomfortable conversation with your doctor or nurse, but come from a place of love. And if you do, then you know you did your part. You can't control how it's received on the other end. So maybe you do get called stupid, or why would you ask that? That's just ridiculous. That's been debunked. Why would you don't believe that? Because that is real. I have heard personal stories of people who have had that experience, and it stinks. It's not fair. Because us as moms, especially as a parent, as a human being, we have a right to understand what we may be doing to our body or to our kids' bodies. And it's really just about having a conversation. It's not about confrontation. It's about problem solving. That's all it is. It's just talking through things and realizing that we're both human and nobody knows everything. And it's okay to not know everything. So when I read that section a couple days ago, I was like, man, I have to talk about this because that's a huge issue that I see between a care provider and a patient. And it's unfortunate. So I would love if you're watching this to just, the next time you're on the phone with somebody in the medical profession, or maybe you have a friend who's promoting something you don't agree with, just show them love, show them compassion, ask questions, plant seeds, just get in a conversation. Communication is what makes the world go round, right? If it weren't for communication, like, where would we be? It's definitely a basic human need, is to be in communication and connection with one another. So I hope that was helpful. I hope that gave you some food for thought, and to just kind of be a little bit more brave or courageous, but full of love, and realizing that you're both just kind of going through this learning curve together, possibly of building this safe relationship to have open dialogue. Like I said, my pediatrician is amazing. And it was when I decided after my first, where I just did what he said. I went with I was go with the flow with my oldest. And then my second, I totally put the brakes on. And he was like, no, I want to just, and he used those words, I want to have an open dialogue. I mean, that means a lot. It means a lot. Because I know there's many medical professionals who go into that profession to help people. But a lot of what helping people is talking to them, getting to know them, building relationships with them. That's what I did as a teacher. That's what you do as a mom. That's what kids do with kids at school. You build relationships with one another. And then you can really be able to plant seeds and impact and bring value and understand one another. If we're not willing to listen to one another, we're not going to get anywhere. So, communication and love.